So we are going to do a central line dressing change, and as you can see here, I already have the patient in the position that I would like him in. I have the gown kind of exposed so it's not going to get in my way. My patient's head is slightly turned away, and I've even moved my pillow a little out of my way. Okay, so I am going to wash my hands and go ahead and open up my kit. Grab the mask for my patient, place it on my patient. It's not going to stay, so I'm going to just lay it there. And I already have my mask on, but for purposes of hearing me, I'm not going to actually put it on. I'm going to take my gloves out without touching anything, set them aside. I'm going to take my biohazard bag out. Opening it up and getting it ready. Okay, at this point I'm going to go ahead and put clean gloves on, and I'm going to head and take my dressing off. As you can see, I'm trying to take it off from outer to inner, while also kind of stabilizing this hub and catheter so it doesn't move. Dispose of that. Okay, now it's completely exposed. I'm going to take off my clean gloves. I'm going to sanitize my hands, and then I'm going to put on my sterile gloves. Sterile gloves are on. I am going to rearrange my kit. Okay, and I have my alcohol swabs that I'm going to open up here. Not exactly easy to open. Okay. Right. I then can clean any of that crusted, kind of scabbed, if need be, if there is anything. I mean, this one obviously looks kind of clear, and then I would throw it away. I can also use these alcohol swabs to clean my lines. Okay, throw it away. Right, and then we're just not going to use that last one, no need. All right, everything looks nice and clean as far as all those crusted areas are away. So now I'm going to pick up my chlorhexidine, go ahead and squeeze it to activate it. It's going to kind of get that pad. Okay. I'm going to start at the insertion site here, and we're going to kind of scrub really good around that insertion site, kind of getting to a larger window away from that site. Okay, covering everywhere that dressing, that tegaderm is going to cover. Okay, now to get underneath those lines, I can take my gauze, lay it there on those lines, and kind of lift and get underneath real good there. Okay, and then I usually, with one last swipe here, go just over my hub and down my lines, and then I'm done with it. Okay, now I have to allow that to dry. Also at this time, if I had a bio patch in my kit, I would go ahead and allow that to dry and place that right over my insertion site as directed. In this case, I don't have one, so we're going to skip that step. But I am ready for my tegaderm now. Very carefully open it up. Iron up where I need to place this. Kind of gently letting it sit, but taking my other hand and really securing right around that site so we don't get those air pockets. And I'm securing from the inside out. Now at this point, everything that needs to be sterile is covered. Okay, I'm going to take the edge of this off, still using my hand here to finish securing this tegaderm all the way around. Don't throw this away just yet. For this particular tegaderm, you've got your sticker for your date, time, and initials. You would date, time, initial it, and then you would place it just off to the side. Okay? I'm not going to do it for this demonstration. Okay? So I'm all down. I don't want any air pockets, and you can see I didn't do that good of a job here, but it's in a difficult spot here. Lastly, I'm going to use this tape I have. Right. I'm going to just put a little extra security on these lines because we use them and move them a lot. So just right here on the edge, butt it up against, not too far covering this tegaderm because we don't want to cover that dressing. Really get in there, get them secure. Because remember, you're using these lines a lot and moving it. And we don't want anything to get up underneath of that. And if there's a spot where it's going to, it would be this spot. Okay. That concludes the dressing change. Gather up all your supplies and dispose of them appropriately. Wash your hands, put your patient back in the proper position, and document.